mental health research series. So if you are joining for the first time, these webinar series are being conducted by TPO Nepal in close coordination with George Washington University. It focuses in the capacity building of early and mid-career researchers. So before moving towards any of the part or structure or content of the webinar, I would like to introduce our team for this webinar. So I am Binita Acharya. I'm working as a research officer at TPO Nepal. Today I'll be moderating this webinar. And as usual, we have Ritika Singh, who is a research consultant at George Washington University. Today, we also have Dr. Brandon Kot, who is a professor at George Washington University, and Dr. Soharda Rai, who is a research scientist at George Washington University. So moving towards the webinar, as you can see in the screen, the title of our 18th webinar, which is From Data to Insights, Leveraging Passive Sensing Technology for Mental Health Interventions. And our speaker is Mr. Sujanman Mahajan. So we will be introducing our speaker later. Before that, there are some couple of reminders or housekeeping items related to the webinar. So first thing first, the first reminder is हाम्रो webinar चाहिँ रेकर्ड भइरहेको छ. हामीले यो webinar रेकर्ड गर्नुको मुख्य उद्देश्य भनेको चाहिँ हामीले वेबिनारको मेटेरियल्सहरु जस्तो रेकर्डिङहरु स्लाइड्सहरु चाहिँ हामीले यो वेबिनार पछाडी चाहिँ सबै रजिस्टर्ड पार्टिसिपेन्टहरुलाई शेयर गर्छौं so that you can get back to us or give any suggestions if there is any, and also see it later and suggest some topics or content related activities as well. So we ensure that we have permission for the recording as well. And also for the webinar materials, please registration form bharnu bhako chaina bhane registration form चाहिँ भर्दिनु होला. So the second reminder of this webinar is related to the webinar structure. So basically the duration of the webinar is an hour. यो 1 hour को duration 6 to 7 नेपाली time मा चाहिँ तीनटा main parts हुन्छ हाम्रो webinar को structure को, which is after this introduction and background session. We will be having the presentation from our speaker for 12 to 15 minutes, where we do not interrupt our speaker. Instead, we let him complete his presentations. And after that, we'll be having question and answer sessions for 10 to 15 minutes. In that question and answer sessions, you can raise your hand with the help of Zoom app and ask your any queries or confusion or concerns related to the content and presentations that you would like to ask to the speaker as well. So before that, please आफूलाई mute बसिदिनु होला so that we could discuss more clearly in the question and answer sessions. So after the question and answer sessions, we will be having our breakout sessions for same 10 to 15 minutes. So हामीले breakout session बनाउनुको main motive भनेको चाहिँ हामीले it will be easier for us to discuss in smaller groups. त्यो smaller group मा चाहिँ हामीले different group मा participantहरुलाई divide गरेर breakout room मा गएर हामीले चाहिँ जुन क्वेशन्सहरु हामीलाई स्पिकरले प्रोवाइड गर्नु भएको छ त्यो क्वेशनहरुमा चाहिँ हामीले डिस्कस गर्छौं. So in that breakout rooms हामीले चाहिँ हामी as a team and स्पिकरले चाहिँ co-moderate गर्नुहुन्छ to facilitate the discussions as well. Also त्यसमा discussion facilitate गर्न हाम्रो स्पिकरको प्रोजेक्ट टिम पनि हामीसँगै हुनुहुनेछ. So after that, we will get back to the main room and summarize what we have discussed in our rooms or related to the questions related to all and share with you all by co-moderator, of course. And the last reminder is related to the feedback form. So we have developed the feedback form to expect some kind of suggestions related to the topic or content related to the webinar to make it more better in the upcoming days. As I have already mentioned that this webinar is focused on the capacity building of early and mid-career researchers. Your feedbacks and suggestions would be highly appreciated. So after all these, the other information related to the webinar is we are conducting this webinar from July 2021 in every third week of each month, except the NTR break or other some kind of yearly review or any emergency. And invitation emails will be sent out with dates and speaker details to all. So you do not have to worry or track it. But if you have any queries related to our network or related to any materials you haven't received, you can directly email us to our official email address and also follow us at our social media pages as well. So these are all about our webinar background and structures. So for now, to introduce our speaker, I'd like to request Dr. Brandon to introduce our speaker, Mr. Sujan.
Thank you so much, Benita. Sabailai Swagatam. So happy to see all of you here. We have about 30 people today to listen to this talk. I'm very excited to introduce Sujan Maharzan. I actually met Sujan about 17, 18 years ago in 2005, and we've been working together off and on since 2006. So definitely, almost going on two decades of collaboration. So he's an absolutely fantastic researcher and has done great things for the global mental health community in Nepal as well. In terms of formal introductions, Sujan Maharjan is a psychologist who holds an MA in clinical psychology from the Central Department of Psychology at Tribhuvan University, Kathmandu. He's currently working as a research coordinator for the project Sensing Technology to Personalize Maternal Depression Treatment in Low Resource Settings, or Stand Strong 2, which is a National Institute of Mental Health from the US funded study. He's doing this at Dhulikhel Hospital in collaboration with Kathmandu University School of Medical Sciences. This is also being done in collaboration with our colleagues here at George Washington University in the Center for Global Mental Health Equity. He also worked in the previous phase and directed the Stand Strong 1 study, which was funded by the Bill and Melinda Gates Foundation, and that was conducted in Chitwan in partnership with TPO Nepal. Besides research, Sujan has gained extensive project management experience by working in mental health and psychosocial support projects for people affected by armed conflict and disasters with humanitarian organizations, including the International Committee of the Red Cross, the ICRC, and Action Against Hunger, ACF. He's also the founder of the Nepalese Psychology Network, NepSecNet, which I know many of you get a lot of information from and has been a big contribution to the field of psychology research in Nepal. Without further ado, I'm delighted to turn it over to Sujan for his presentation on passive sensing and its contribution to mental health research in Nepal. Thank you so much, Sujan, for joining us today.
Thank you, Brandon. Let me start this. I hope you can see the screen.
Yes, we can. Thanks.
Yeah. Okay. Thank you, Brandon. Thank you, team, for introducing me. So I'll be talking today about our research in Dhulikhel. So yeah, just to give a brief overview, I will just go through this steps. So I will refer our study as Stand Strong. So it's the sensing technology to personalize maternal depression treatment in low resource setting. So we at Dhulikhel Hospital, Kathmandu University School of Medical Sciences, we are currently doing this study in Dhulikhel to improve the community level treatment of maternal depression in Nepal by using the digital technologies. As we know, since the last few years, technology has been a necessity for every one of us. I think every one of us has smartphones these days, and smartphone these days are a very powerful devices which collects our information, and it really gives us the insights about our well-being, health, and many other domains of our life. Basically, I'll focus more on passive sensing technology. There is active sensing and passive. So passive sensing refers to gathering data through technologies about persons' activities, behaviors, without requiring their active participation. In terms of background, there has been some studies done previously, like Stand Strong 1 that was done in Chitwan, and before that also there was a study done by Brandon and the team, regarding the assessment, cultural assessment, what kind of digital sensing technologies would be appropriate. The papers are available, so you can read it. Going into our study, so we are currently doing the study at the Kavri district. Our focus areas are 5 municipalities: Dhulikhel, Banipa, Panoti, Panchkhal, and Namabuddha. And we are using the mixed methods. Our sample size is 100. We are using the purposive sampling. And talking about the inclusion criteria, especially we enroll the mothers who are between the age of 15 to 45, and the child age is below 12 months. We do the screening by using the PHQ-9 tool. So our objective is to test the integration of digital technology for the psychological treatment delivered by non-specialists in low resource settings like Nepal. In our study, we mainly have like two aims. So the first aim is refining platform and user testing, and the second aim is proof of concept testing. I'll talk more about that later on. So as for the intervention, we are using the problem management plus intervention, which has like is structured into 5 sessions, and it's available online. It can be used by we can use this intervention especially in settings where there are like where there is a lack of trained specialists. So talking about our Stand Strong platform, how we collect the data. So the main participants we have in the study are the mother and the child. So the mother gets the smartwatch. She wears the smartwatch for a period of time during the study. And the baby gets the beacon in a pouch. So it's goes around the waist of the baby. So these devices mainly collect these 5 kinds of passive data. The proximity between mother and child. So the Bluetooth, using the Bluetooth, the beacon is connected with the smartwatch. So we get the information about proximity between baby and mother. Similarly, GPS. So it give us the information about the movement. Like by taking the coordinates of a home location, we can know like how far the mother travels in a day. Similarly, the app also collects like the small clips of audio that tells us like in the environment there is a human speech or no speech. Similarly, the steps and beat per minute heart rate. So these information are collected by using the devices, and then this is processed by the programs, and then these are like we can see as the charts like what kind of data is coming through the devices we get to know. And then like the counselor sees this information about the participant, and then before she goes for a weekly session, she consults this data and then sit down for the sessions. So during the sessions, she refers to this data to gain insights into like her daily life and what's happening. So in terms of behavior change, this information can be really useful. So I would now like to go into the results. In terms of aim 1, we have done some FGDs with mothers, husbands, mother-in-laws, nurses, counselors, even tail lagaउने didis who are like closely associated with new mothers and FCSBs. So during these FC focus group discussions, the main domains that we have explored are like the social connectedness, about the feasibility, acceptability, utility, and perceived benefit. So these FCDs have been really helpful for us, especially in terms of producing like the consent video. So in our study, what we are doing is like because it involves a lot of technical things. So we have made a small video that we show to a participant and her family to explain about the study. So it's easier with the consent video. So while making this video, the FGDs, their like a feedback was really useful. And we have tried to adapt like our like make changes to technology, our recruitment strategy based on the information that we have got from the FGD. So this is just sample in table, like how we considered the feedback, the key issues they raised, and what changes were made based on their feedback. So these are some of the pictures with the health professionals, with the FCSBs and the group of counselors. We did it at the PK campus. Similarly, for the AIM2, this is the proof of concept testing phase, which is actually ongoing at the moment. So far at the beginning, we tested this technology with the healthy mothers. So that was for the period of 2 weeks only. We had like 6 mothers participating in the study. They wore the smartwatch and they put the beacon on the babies, and they provided us the feedback of their user experience, or what they felt like, what kind of challenges they faced while using the technology. And then now we are currently working with the depressed mothers. So far we have enrolled 15 mothers. 5 have already completed, 7 participants, they are ongoing, and unfortunately we also have had some dropouts, so 3 of them have dropped out. It's for a longer period of time, it's for 7 weeks, and we also have some participants who refuse to participate. So most of the participants, they have reported feeling comfortable without experiencing the negative effects. And in our experience, we have realized that families do matter. So the role of families are really, really important because they really influence the participants' decision and their involvement study. We have also been able to use the passive sensing data in the counseling sessions, especially from the second session. So far, we have screened 403 women by approaching much more. Enrollment 15 so far. These are some of the sample charts that I'd like to show you now, how we get the data and how it's visualized for our team, like the counselor and the research team. So we regularly monitor these charts, whether the data are coming or not. So here you can see regarding the audio, we associate with the social interactions. So in the environment, whether there is speech or not, that's the indicator whether they are having some kind of social interaction or not. So the app, it scans in the environment every 15 minutes. So every time there is a speech, so it detects we can see it hourly, on an hourly basis, or even the daily basis. Similarly for the proximity, so we know whether the child is together or not. So usually the baby and mothers, they are usually together. We currently have more mothers who are staying at home, very few who are working. So usually the mother and babies together. But in some cases, there might be no data as well. If they forget to wear the watch, or they put it away. In terms of GPS, we can learn how far they travel from their home. This one is of a working mother. So it shows she travels up to more than 5 kilometers in a day, for her work. So we can also detect the time she's away from home and she goes back. So this is also a very good indicator whether she's having movement or not. And this is for the steps. So by scanning we try to learn like whether they were physically active or not. Even our phone, it has the accelerometer, so it tracks like how many steps we are taking. Similarly, apps also it detects like how many, whether there is some kind of activity or not. Uh, Working with the technology, we have come across the issue of confidentiality very often. Many people, they are concerned about the data privacy and the confidentiality. So we have always made effort to explain it clearly and to ensure that your data is private and the security issues are well maintained. So currently in our study, the data is not stored locally in a device. Usually before, the data used to be saved locally in the device, and only then it used to sync. But now we are trying to directly sync it to the servers, cloud servers, and then it will be processed by the machines. So that helps us protect the data of the participants. Similarly, our research team also makes every effort to remove the identifiers while storing the files related to them. I would also like to share some of the key challenges we face while doing this study, identifying participants. We have realized although we approach many women, but it's also a good thing. The rate of women with depression is low, but for us it's also a challenge. In terms of family consent, also sometimes the family, they do not allow a woman to participate in the study because usually uh, the woman, they face have the problems because of the family dynamics. So sometimes family, they are not willing to allow their family member to participate. Another big challenge is the limited battery life of the smartwatch. This has been quite a challenge for us, but we hope as technology develops, we'll have more powerful batteries. But at the moment, because the battery runs out very quickly, so that's a challenge for data collection. Another challenge is while doing the counseling session, because we do the home visit and do it at their place, so lack of privacy is a big challenge for us as well. Um, and then the technical things, always while working with the app, there are always issues coming up, and then there are things that we need to fix. So these are some of the key challenges. In terms of now I would like to conclude. Maybe I'm near time, right, Vinitaji? So yeah, how many minutes left?
2 minutes.
Okay, yeah, thank you. So far, we have done this study in Chitwan. Now we are doing this study in the Tulikel. So it gives us an opportunity to also evaluate how we can use the digital technologies in low resource setting like Nepal. And we hope that this kind of technology will help us to personalize the psychological treatment for the participants that lack the capacity for quality mental health services. Usually, it's like a standard approach. There is a intervention, and then we just go and deliver. There are always limitations to make an adaptation and changes, but with the help of technology, we hope it helps us to tailor the intervention. Similarly, we hope the mobile technology sensors can be used to construct reliable models that can associate with specific activity with postnatal depression, such as length of time spent with the child, types of vocal interactions, physical activity, and also frequency of outings, movement. So in conclusion, I definitely think recently, especially with the advancement of the technology and AI, we all know this will really help us to gain, provide valuable insights into a person's mental health, and will be definitely useful for detecting early signs of mental health issues and adapting the intervention. Thank you. Sorry, I just have one more slide left and then I'll finish. So I would also like to acknowledge my team. So our team members, they come from different universities. Brandon, Al, Dr. Razi from Tulip Health Hospital, Ashley from Yale University, Dr. Abba Anjana from Tulip Health Hospital. Similarly, Christina is also working with us. We have Praveen Benzankar as an IT consultant. And we have as a research team, Smriti, Alka, Richa, and Bhavisya. Puspanjali is working as a counselor in the project, and this study is supported by the National Institute of Mental Health. Thank you.
That was such a great work and presentation, Sujan sir. So now the floor is open. हजुरको केही क्वेशन्स क्वेरिज छ भने चाहिँ हजुरहरूले ह्यान्ड रेज गर्न सक्नुहुनेछ or directly comment box मा राख्न सक्नुहुन्छ. So we'll be having 10 minutes question and answer sessions. So we already have questions from Distri ma'am. So like how government stakeholders, including NHRC, and reacting to this study in terms of data safety and security. Distri ma'am is asking questions.
Okay, thank you, Distri, for the question. Yeah, definitely with the NHRC, they definitely have the concerns regarding the data safety and security. They are concerned like how these data are processed, stored, and managed. And then we have also had them visit early last year, although they were so interested that they made a field visit, and we had a meeting, and then we explained how these are managed. We have these servers that's only assessed by our team, the tech team. So and the data is not cannot be assessed is not put publicly or it's in the secure servers.
So we also have another questions from Ritika ma'am. So the question is, especially in a country like Nepal, where children are seen as collectively of a family, how did you overcome the challenges of getting consent?
Yeah, definitely. We come across for getting consent also sometimes it's challenging because it involves technology, and putting the beacon on a child is also a sensitive thing. So but as we explain them about this study, it's for improving mothers well-being, and it also contributes to child's health and well-being. So we are able to explain slowly. So this consent video has also been very, very helpful for us because it explains very much in detail how we collect the data and what happens to this data. Basically we explain them. It's not just once, but we sit down several times if necessary. And also in the consent form, there is a good description of the overall process.
Okay, so other questions, and you can raise your hand in the Zoom app also. Okay, we have another questions. So Great work, Sujan. I appreciate the comment that this work can personalize mental health care. I was curious about your thoughts about this in relation to cultural needs and tailoring to Nepali women. How could passive sensing support a culturally focused adaptation of care, do you think?
Yeah, thank you, Gloria, for the question. Yeah, in terms of cultural adaptation, we are trying to do this like for women like having like postpartum in the postpartum situation. Um, we are like saying like at the moment we are testing like using the digital technologies whether or not like we can get enough information, and then like our counselor like she uses it like while interacting with the participant in the sessions, in terms of like more like culturally adaptation of care. I think we need to do more or work on this. Definitely like cultural sensitivity, like privacy, like this has like been a challenge. Like sometimes it's really difficult even to have a secure place and to discuss with the client about the data. Yeah, these kind of things we hope to address in the future.
Okay, I think they have got their answers as well. So anyone, if you have any queries, so yeah, there are so much of appreciation also, Sujan sir.
Thank you very much. Yeah.
Yeah. So we have time for 2 questions for now. Then we will move towards the breakout rooms, where we will be discussing the questions which is provided by our speaker. So if you have anything to ask before that, you can raise your hand.
Well, Suzanne, can you hear me?
Hi.
All right, great presentation, Susan, as everyone said. I was just curious to know, like if you or anyone in your team, or even like within the audience here, know of any such initiatives or any such research that has been taking place in Nepal with the similar kind of technology or with the same idea?
So in mental health, I think, of course, like I think people are using digital technologies like other projects also like for training the health workers, especially after COVID, like we see the uptake of digital technologies so much, like it became a necessity for all of us, like for our work and learning also. Some use like SMS technologies to deliver some kind of health messages for the intervention or to collect some kind of data. And of course, I think other like public health programs are also there using the digital technologies, like especially for the other non-communicable diseases like diabetes and blood pressure, etc.
Okay, I have seen, I think Raven was trying to ask some questions. So you can ask now.
I also had a question. So Jen, especially in research, all kinds of research, there are frequent dropouts. And we're always encouraged, of course, it is an individual's, it is in their full, it is their decision whether or not they want to participate in our research or not. But we also have like ethical standards to hold on to and reporting mechanisms to adhere to in our research. So I can see that the number of dropouts is very low, but then was there any kind of reason that they gave for dropping out of the study, and did we try to create any mechanisms to sort of ensure that we would not have dropouts in the future?
Yeah, Ritika. So we had a few dropouts so far, especially their reason for dropout was like some participants thought their problem is gradually decreasing, and they thought they don't need an intervention. So they felt if the intervention, they don't need the intervention any longer. So they thought there is no point in wearing the watches. So they gave it back to us. And some in one case, I remember the participant had to travel to another place, and then so she requested us she could no longer participate. So the traveling, migration, and the problems being solved are some of the reasons.
Okay, with this, there are so much of appreciations for your research efforts and impressive results as well, Sujan sir. So for now, we will be moving towards the breakout rooms. So Ritika ma'am, are the rooms ready?
Yes, thank you, Bintaji. The rooms are ready. I'm going to open the rooms in a minute. Just to let everybody know that the breakout rooms close immediately after, let's say, around 13 to 14 minutes. So this is just, there is a small countdown timer at the top of your screen. So please be aware of that as well. And I hope you all enjoy the breakout sessions. I'm opening the rooms now.
भनेपछि अनि त्यो भाइलाई बोलाएर
हुन्छ
हजुर यो चाहिँ
म्याम,
हाम्रो
थ्याङ्क यू।
छ यो चाहिँ हाम्रो अब क्लास कहिलेतिर छ क्लास चाहिँ दिँदै हुनुहुन्छ
हस्, थ्याङ्क यू।
हस् थ्याङ्क यू
थ्याङ्क यू। ओके, डिस्कसन हुँदा हुँदा रोकियो, बल्ल लास्टमा डिस्कसन हुँदै थियो किन हामी सबैजना नयाँ भएर चाहिँ हामीलाई डिस्कस स्टार्ट गर्नु र कुरा भन्नु नै गाह्रो भयो सुरुमा। सो समरी गरौँ है सुरुमा।
प्लिज।
सुरुमा हाम्रो क्वेसन्स भनेको नै च्यालेन्जेस इन कलेक्टिङ फर डेटा फर मेन्टल हेल्थ युजिङ डिजिटल टेक्नोलोजी थियो। यसमा चाहिँ हामी सबैको एकदम कमन भनेको चाहिँ जस्तो अब अहिले मेन्टल हेल्थको कुरा भनेको र मेन्टल हेल्थ कन्डिसन्सको कुरा भनेको चाहिँ एकदम हाम्रो सोसाइटी र कल्चर अनुसार चाहिँ त्यही कुरा नै हामीलाई बुझाउन गाह्रो हुन्छ। जस्तो हामी नै गए पनि डेटा कलेक्सन गर्ने कुरामा सबै कुरामा गाह्रो हुन्छ किनभने एकदम स्टिगमाटाइज हुन्छ। सो द्याट त्यही नै बुझाउन गाह्रो भइरहेछ। हामी गएर भने डिजिटल टेक्नोलोजी जिपिएसको कुराहरू यस्तो कुराहरू मान्छेले सुन्ने बित्तिकै आत्तिनुहुन्छ। सो द्याट त्यसमा चाहिँ जस्तो कन्फिडेन्सियालिटीको कुरा प्राइभेसीको कुरा आएर चाहिँ कसरी गर्ने के गर्ने भनेर उहाँहरूलाई इन्सेक्युर फिल भएर चाहिँ त्यसले गर्दा च्यालेन्जेस हुनसक्छ होला डेटा कलेक्ट गर्नेमा भन्ने छ। अर्को भनेको चाहिँ जस्तो मेन्टल हेल्थमा कन्सेन्टिङ लिने बेलामा चाहिँ फ्यामिलीको कन्सर्न जस्तो रेकर्डिङ हुन्छ अनि यस्तो पर्पजको लागि गरिएको भन्ने भयो भने चाहिँ उहाँहरूलाई आफ्नो इन्फर्मेसन अन्त कतै जान्छ कि सोसियल मिडियातिर जान्छ कि हामीलाई कसैले के भन्छ कि भन्ने कुराले गर्दा प्राइभेसीको म्याटरले गर्दाखेरि नै उहाँहरूलाई एकदम धेरै च्यालेन्जेस हुन्छ। डेटा कलेक्सनमा उहाँहरू कम्फर्टेबल फिल गर्नुहुन्न। जस्तो हामीले डेटा कलेक्सन गर्ने बेलामा चाहिँ हामीले हाम्रो पर्पजको कुरा गर्छौँ तर उहाँहरूको एक्सपेक्टेसन के छ इन्ट्रेस्ट के छ भन्ने कुरालाई चाहिँ हामीले प्रिटिक्वेसेट हो भन्ने कुरा चाहिँ हामीले एकदम कम रिसर्चरमा हुन्छ। सो द्याट उहाँहरूको त्यसलाई ओभरकम गर्न चाहिँ उहाँहरूको एक्सपेक्टेसन के छ र केले गर्दा कमिटमेन्ट गर्न सकिन्छ। मानौ अब जस्तो डेटा कलेक्सनमा हुन सक्ने बायसको लागि आर्यहरूलाई अथवा काउन्सिलर अथवा कोही रिलेटेड हुनुहुन्छ भने उहाँहरूलाई चाहिँ त्यसको ट्रेनिङ दिँदाखेरि चाहिँ ओभरकम गर्न सकिन्छ होला कन्सेन्टिङमा बुझाएर। बट एट द एन्ड च्यालेन्जेस भनेको चाहिँ जस्तो आइटीको कुराहरू र डिजिटल टेक्नोलोजीमा कति धेरै सब्जेक्टहरू हुन्छ। जस्तो आइटी पढ्नलाई कति धेरै गर्नुपर्छ। सो द्याट त्यति कुराले मात्रै सबैजना एकदम कमन बुझिहाल्नुहुन्छ भनेर रिसर्चमा डेटा कलेक्सन गर्न इजी नै हुन्छ भन्ने चाहिँ हुँदैन। त्यो कुरा नै इस्यु र च्यालेन्जेस हुन्छ भन्ने चाहिँ हामीले डिस्कस गरेको थियौँ। अर्को भनेको चाहिँ जस्तो हाम्रो एज ग्रुप अरू ग्रुपमा चाहिँ सबैजनासँग स्मार्टफोन डिजिटल टेक्नोलोजी हुन्छ भन्ने चाहिँ हुँदैन। अनि त्यसपछि त्यो युज गर्ने टेक्नोलोजीहरू युजर फ्रेन्डली छ कि छैन भन्ने कुरा पनि च्यालेन्जेस हुने भयो। अनि ब्याट्री लाइफको कुराहरू अनि अपरेटिङ सिस्टमहरू कसरी भइरहेको छ। जस्तो मान्छेहरूले यसै काममा बिजी भइरहेको हुन्छ मेन्टल हेल्थको इस्युमा पहिल्यै स्ट्रेसफुल भइरहेको हुन्छ तर उहाँहरूलाई यो टेक्नोलोजी कसरी हो के हो भनेर बुझ्नलाई नै टाइम गएर अरू काम भन्दा पनि त्यो बुझ्नलाई नै टाइम गएर पहिल्यै कमिटमेन्टमा एकदम धेरै इस्युज आउँछ भन्ने चाहिँ हाम्रो डिस्कसन्स थियो। सो यति नै हो। थ्याङ्क यू।
Okay, so question wise जाँदा हाम्रो second question मा चाहिँ नि how do you ensure data security र privacy especially passive sensing data जस्तो sensitive data collect गर्दाखेरि भन्ने थियो। हाम्रोमा पनि साथीहरू passive sensing डेटामा त्यस्तो धेरै युज नभएको कारणले चाहिँ नि धेरै जस्तो डेटा प्राइभेसी र सेक्युरिटी कस्तो गर्न सकिन्छ भनेर कुराकानी आयो। हाम्रो एकजना साथीले चाहिँ हामीलाई के भन्नुभयो भन्दाखेरि नेपाल गभर्मेन्टले नै एउटा पोलिसी प्रपोज गरेको छ रिमोटली कलेक्ट गर्ने अथवा रिमोट केयरमा कुनै पनि किसिमको डेटा कलेक्टेड छ भने चाहिँ त्यसमा कुन किसिमको प्राइभेसीको रेस्ट्रिक्सन्सहरू राख्ने भनेर चाहिँ देयर इज अ पोलिसी प्रपोज्ड। तर त्यो लास्ट इयर प्रपोज भएको थियो तर पास चाहिँ भएको छैन भनेर हाम्रो एकजना साथीले भन्नुभयो। त्यसको पोलिसीको हामी nitty-gritty मा चाहिँ जान सकेनौँ but this could be an interesting thing for हाम्रो participants to know about. And at the same time हामी चाहिँ we started talking about how data privacy begins at consent. Consenting मा नै हामी careful हुनुपर्छ by maintaining how we will be ensuring data privacy रहन्छ भनेर। अनि कुनै पनि रिसर्चमा कुनै पनि किसिमको कुराकानी गर्दाखेरि anonymity राख्ने de-anonymized डेटामा मात्रै काम गरिन्छ भनेर थाहा पाउने र त्यो कुरालाई पनि putting it across is also very important भन्ने आयो as a part of ethics. So हाम्रो discussion चाहिँ was centered around this thing. Thank you. So the next question हुनुहुन्छ अनि सुजन last question हुनुहुन्छ।
हुन्छ हाम्रो क्वेसन चाहिँ मोर passive sensing technology चाहिँ early warning sign कसरी लिने अनि intervention चाहिँ how can we work on that भन्ने थियो। Unfortunately हामीसँग चाहिँ पुष्पाञ्जलजी हुनुहुन्थ्यो who is counselor working in Stand Strong. So हामीले धेरै कुराहरू गर्यौँ in terms of कसरी चाहिँ उहाँले चाहिँ say passive sensing technology, but say sign or say like for example GPS ko kurama alikati ama depressed bhछ भने चाहिँ एकै ठाउँमा बस्नुहुने अनि त्यही अनुसार चाहिँ उहाँले चाहिँ कसरी चाहिँ आफ्नो सेसन्सहरु चाहिँ टेलर गर्नुहुने भन्ने कुराहरु चाहिँ हामीले गरेको थियो. So got a lot of insights on how everything works. So Pushpanjali बाट on audio को कुराहरु पनि, and obviously we talked about some challenges. जस्तै पोस्टमार्टम पिरियडमा हुने गर्दाखेरि हाम्रो कल्चर अनुसार चाहिँ धेरै मान्छेहरु भेट्न आउँदाखेरि अडियो धेरै सुनिनु पनि सक्छ. सो त्यो कुरा पनि हामीले गर्यौं. अनि obviously we also talked about some kind of challenge in terms of confidentiality को कुराहरु, though we're not, that is not in a part of our question. त्यो पनि हामीले चाहिँ गरेको थियौं. हस् रितिका त्यति.
Question number 4, how do you validate the accuracy and reliability of passive sensing data, and what steps can be taken to ensure the data is interpreted correctly? भन्ने हाम्रो ग्रुपमा परेको थियो. हाम्रो ग्रुपमा पनि पार्टिसिपेन्ट्सहरु नयाँ हुनु भएको हुनाले हामीले अलि डिस्कसन नै गर्यौं. त्यति धेरै हैन, तर जस्तै अब टेक्नोलोजी छ, डिभाइस छ भन्दैमा त्यो आएको डाटा साच्चै नै हो र भन्ने खालको क्वेशन त एकदमै इम्पोर्टेन्ट हुन्छ. किनभने हामीले घडी दिइराछौं तर पार्टिसिपेन्टको ठाउँमा पार्टिसिपेन्टको बच्चाले हस्बेन्डले लगाइदियो भने त त्यो डाटा त एक्युरेट आएन हैन. अनि टेक्नोलोजीमा रिलाइ गर्नुमा पनि क्वेशनहरु उठ्न सक्छ. त्यो भएको हुनाले जस्तै अब हामीले विभिन्न खालको स्टेप्सहरु लिन सक्छौं. अब हामी उहाँहरुलाई भेट्न गइरा हुन्छौं हैन, फोनबाट पनि हामीले टेक चेक इनहरु गर्छौं. अनि अब हाम्रो रिसर्च टिम चाहिँ अब गएर भेटिरा हुन्छ. त्यो बेला चाहिँ एकदमै हामीले इन्डाइरेक्टली पनि सोध्छौं उहाँहरुलाई हैन. अब एकदमै अनयुजुअल डाटाहरु आइराछ भने त हामी डाइरेक्टली सोध्न पनि पर्ने हुन्छ उहाँहरुलाई. सो उहाँहरुलाई नै सोधेर चाहिँ बेसिकली हामीले भ्यालिडेट गर्ने हो. पार्टिसिपेन्टकै रिपोर्ट्सहरु हैन, उहाँकै कुराहरु चाहिँ एकदमै इम्पोर्टेन्ट हुन्छ. र अब टेक्नोलोजीको कुरा गर्न पर्दाखेरि एकदम प्रविधि विकास भइराछ, तर धेरै मिसइन्फर्मेसनको इस्युहरु पनि आइराको छ हैन. त्यो भएको हुनाले अब यो एक्युरेसीको कुराहरु चाहिँ एकदमै इम्पोर्टेन्ट छ भन्ने कुराहरु चाहिँ हाम्रो ग्रुपले गर्यो. अर्को कुरा अब टेक्निकल च्यालेन्जेस पनि हुन सक्छ हैन. डाटाहरु सिंक नहुने, अब जहाँ अलिकति ब्याट्रीहरु चाँडै सकिने, नेटहरु चाहियो, फेरि यस्तो खालको टेक्नोलोजीलाई राम्रो इन्टरनेट कनेक्टिभिटीहरु त्यो नभएको अवस्थामा पनि भ्यालिडेसन गर्न चाहिँ च्यालेन्जिङ हुन सक्छ. हाम्रो ग्रुपमा यस्तै कुराहरु आयो. धन्यवाद.
Okay, thank you सुजेन सर. आज एकदम राम्रो डिस्कसन्स भयो. सो होपफुली धेरै जनाले बुझ्नु भयो पनि. जस हामी नि नयाँ भएर चाहिँ हामीलाई यो सुरुमा स्टार्ट गर्न गाह्रो भएपछि एकदम मस्ट निडेड टाइटल जस्तो लाग्यो. सो थ्यांक यू फर कमिङ अप विथ दिस टाइटल एन्ड शेयरिङ such a great work with us. So we are already out of time. Thank you so much everyone for your active participation. See you in the next webinar. Thank you so much Ritika ma'am, Sawarda sir and everyone.
Thank you.
Bye bye.
Thank you, Nancy.
Thank
Bye-bye.
you. Thank you,
Bye,
Central
everyone.
team as well. Thank you.
Thank you. Bye bye.
Thanks, Suzanne.
Bye.
Thank you.
Thank you.
धन्यवाद सबैलाई.